great to be here today. I'm a nurse, and I've had the pleasure of working in home care, actually here in Vancouver. I've worked in hospitals, large and small, rural and urban, Canada and other countries. And I've also worked in nursing homes, and I hail from Alberta originally, and I'm a researcher, and much of my research is around palliative and end-of-life care, but also aging as well, too. Now, most of you know that Alberta is the youngest province in Canada. We have the smallest proportion of seniors. This is why we always look to the wonderful work that's done here in Victoria and Vancouver and in BC in general, very creative and innovative policies and programs. So we always kind of look to what you're doing, and then whatever you're doing that's good, we copy. Anyway, what I'm going to do is focus on palliative or end-of-life home care instead of palliative end-of-life in general, because at this point in time, most large cities have a specialist palliative care team, sometimes more than one team. Most large hospitals in Canada have a specialist palliative care team. All nurses going through the basic programs, all medical students going through medical programs receive palliative end-of-life care training. The issue, though, is home care continues to be the most under-researched, undervalued, and basically invisible health service in Canada. And imagine ever finding on the front page that someone's mother didn't get home care, couldn't qualify for home care, they only got 2 hours a week. Compare that to when our emergency departments are full, our hospitals are full, and we have an accord that pumps billions of dollars into shortening wait lists for surgery and reduces the length of stay in hospitals and emergency departments. So I'm going to focus on home care. Now, what's interesting as well, too, Canada is quite unusual when you look at death and dying. Most other countries around the world have set up an extensive system of hospices, freestanding hospices, where a city like Vancouver or Edmonton, where I hail from, would have at least anywhere between 4 and a dozen freestanding hospices, where people could go for day programs. So if your dying mother was living with you, you could still go to work because you would drop your mother off in the morning and pick her up when you finish work. And the hospice also, typically most of them would have inpatient beds. So if your mother had a downturn in her health, she could go there. If she got better, she would come home again. Or even the last few days of life, when it became evident that she was actively dying, that there would be a hospice, that you would not have to go to an emergency department to wait for hours to be admitted into a bed. So Canada, in some ways, is lagging far behind what other countries have done. Now, Vancouver, you have some hospices here. I live in a city where there is one hospice, and it only provides day services. So we actually don't even have a hospice in Edmonton. So we're really lagging behind. Now, what I'm going to focus on in terms of home care is that in recent years, I think we'd all agree that there have been some major healthcare and socio-demographic developments, ones that are really impacting and are going to continue to impact home care. And I'd like to sort of leave two questions, put them out front and center, and come back to these questions at the end, because we've had a wonderful presentation by Donna about looking at aging in place. Certainly, if you look at all of the government policies for aging, certainly every one of them at this point in time say we need to support aging in place. Of course, that can mean home alone. That can be a very difficult sort of thing. But can we begin to think about dying in place? Will that ever become a major focus of policy and practice? And also, if you begin to think about this as well, is it possible for terminally ill people in the last year of life, so if you know you're dying, you know that there isn't another medication or another treatment out there that will cure you or extend your life, or you're actively dying, is it possible for them to receive enough palliative end-of-life care at home for them to have a good death? Now, much of the research I'm going to be talking about in the next few slides addresses these questions. It's research that have been done by myself, but it's also been greatly informed by the other Canadian research that's been done. So I'm going to hit on 5 topics today: the number of deaths that take place in Canada each year, and some expected trends. I'm going to talk about age at death and some trends, a few other developments that are impacting the end of life, the changing location of death, what do you really need at the end of life, what are your care needs, and end-of-life home care. I want to talk about what it's like in Alberta, and I'll compare that to some other places as well, to how much home care you can get if you are designated as palliative, if they know that you are dying. So let's start out by numbers. Now, every year I get mortality data from Statistics Canada, although in some recent years now, Quebec doesn't add their mortality data, so it's so there's a big issue there. But anyway, in 1950 in Canada as a whole, there were almost 125,000 deaths. 2008 data, which I just got last month, kind of a little slow, but anyway, it came. There were nearly double the number of deaths in Canada. Now, we've got just more Canadians, and, they're reaching the end of life. So in 60 years, the number has basically doubled from 1950 to the current time. Now, we all know about that large baby boom generation, and out of curiosity, who's a baby boomer here? You were born in 1946 to 1965. Anybody a baby boomer? Okie doke, yeah. Well, you know we're that big bulge. We're 1 out of every 3 Canadians right now, or 10 million Canadians. And of course, there's an enormous worry about that group, that, we're all going to get sick when we turn 65. We're going to be in hospital every other day, or we have nothing better to do. We're going to sit in an emergency department because we have no hobbies, no friends to talk to, and we're home alone. Well, anyway, we forget the fact that currently there are 4.6 million Canadians who are older than the baby boomers. Now, those are the people who are most at risk, just simply because of age, of needing some end-of-life care. And I'm going to get into how much they're going to need. Now, what's interesting, though, is so it took 60 years to double the number of deaths in Canada because of not only the baby boomers, who are starting to reach an age where death is more likely, but also because of their parents, their aunts and uncles, and in some cases grandparents. Those people will inevitably reach the end of life. And that means that in as little as 10 to 20 years, we will have twice as many people dying in Canada. Now, think about it. We have full emergency departments and full hospitals now, and we have very few hospices. And I'm going to talk about a few other things. So anyway, here, most of you have seen the age pyramid. This is this wonderful thing that you can get. You can actually get a little video, and Stats Canada puts this out. And of course, there's that huge baby boom generation, which is, many of them are living well, and we expect most baby boomers expect to live into their 80s, and probably will be the highest proportion in any generation before or after that will be more likely to reach the age of 100. So it's very likely that many of the baby boomers will get close to 100 years of age, not the 78 or the 79 that some people commonly think about. Now, why I say that is, again, because I get to see Statistics Canada data that has showed that the average age at death has increased every single year since 1950 in Canada. Every single year, the average age of death has gone up. Very small creep. And anyway, we know for sure that there's both an aging trend in Canada, but what most people don't recognize, although maybe I'm talking to the people who do know, that actually the big increase in population increase, subpopulation group, has been in people who are 85 years of age and over. Many, many, many more people are reaching age 85. And in fact, if you look since 1950, there's been a 331% increase in the number of people who reach age 85 or over before they pass away. And of course, we know that women live longer, and that's not likely to change. We also know that there's a reduced birth rate, which means that baby boomers are much more likely to have more sisters and brothers than children. Is that correct for everybody here that's a baby boomer? Yeah, it's certainly in my case, which means I'm being very nice to my niece and nephews, by the way. Okay, and we also know that less than half of all people now when they pass away are married. And that's a big issue because the number one caregiver at the end of life is a spouse. We also know that healthcare has changed incredibly much in the last few years, and it keeps changing as well. But the major trend in healthcare is we have an increased outpatient and day surgery care. Would any of you be surprised to know that about 95% of all surgeries in Canada now are done on a day surgery basis? 95%. 99%, if not 99.9999% of all tests and treatments are done on an outpatient basis now. We have very few inpatient beds and certainly not a lot of interest in building more. Now, all of these trends are certainly going to impact, they are impacting, but they will continue to impact end-of-life care needs and also the provision of end-of-life care. And here again, if you just kind of need to see this, if you look at 2008 data, the majority of people, again, live to be age 65 or over before they need some end-of-life care. And if you like numbers, 2% of all deaths in Canada take place between the age of you're born up to the age of 22, 2%. 22% are between the age of 0 and 64. And that means the vast majority, again, of people do not need end-of-life care until they at least reach age 65. But again, a huge proportion, nearly 1 in every 4 persons, are age of 87 or over. So very, very interesting what's happening in age at death. Now, another major thing to point out, the third big topic I really want to feature, is location of death. And now most people are just quite astounded to know that since 1994, we have had a major decline in deaths in hospitals across Canada. In 1994 was the peak when it was close to 80% of all deaths. We're now sitting at about 60%. And in Alberta, actually, it's less than 50% of all deaths take place in a hospital bed. Now, what's interesting is if you look at the Stats Canada data, this shift out of hospital, you think, oh, well, it's nursing homes. We have an aging population. They're all going into nursing homes. Actually, no. The interesting thing, it's equally, there's been an increase in nursing home deaths, but there also has been an increase in home deaths. And in fact, 85-year-olds and over are the most likely of all age group to die at home. I have to say that again in case you don't believe. So again, if you happen to be 85, 90, 95, 100, your age group is the least likely to die of all other age groups in hospital. You are much more likely to die at home than any other age group, if you can imagine that. Unbelievable. Okay, let's talk about end-of-life care needs. Well, one of the saddest things is probably one of the most under-researched area is what kind of care do you really need in your last few days of life or your last few weeks of life? What we do know, and there's a wonderful end-of-life report for Western Canada from CIHI, and some of you may have contributed to that, and some of the research that I've done points out that end-of-life care needs are incredibly diverse. Some people need no care whatsoever. These are the 10% of people who just suddenly pass away. There's still 10% of people across Canada who just go to sleep one night and they don't wake up, or they're in a tragic car accident or suicide or something where, again, there's no end-of-life care needs whatsoever. Amongst the other 90%, well, there's some who reach pretty well 100% need. These are the poor, unfortunate ones who do end up in nursing homes, and this is why seniors fear so much. It's not that they fear going into a nursing home, they fear having such a high need that, in fact, they're severely demented, severely incapacitated, that they need nursing home care. And typically, those are the people that about the last 3 or 4 years of life, they have a very long, dwindling, or lingering dying process. So again, we're looking about 3 to 4% of older persons who may need that nearly 100% care or 100% care, and a few younger people as well too. The unfortunate with MS and ALS and a few of those very severely disabling diseases. The vast majority, there's some research that I've done and others have done, pointed out that the vast majority of terminally ill and dying people are actually relatively well, not in hospital, and still ambulatory until the last 1 to 3 days of life. Very different from what you expect, isn't it? The other interesting thing, too, is that the vast majority of people now, 90% of people, know that the clock is ticking. They know that they are facing the end of life. It's not going to be a surprise, and in fact, their families over time begin to expect it as well and plan for it as well, too. Death and dying is very different today. And I'm going to love discussing, some of this with you. Okay, the fourth point is, what is quality end of life? What is a good death? And some of the research I do looks at good deaths. But there's a physician actually in Toronto, Peter Singer, who did a wonderful qualitative study back in 1993 that's just hard to beat. And he talked to long-term care residents, HIV victims, and dialysis patients to talk about, well, what is quality end of life? And they said, well, it came down to these 5 things, and these are hard to argue against. But if you're dying, you want to know that you will get adequate pain and symptom management. You may not need it, but particularly when you do need it, it should be there, and it should be there right now. And you also should be assured that it's there if you do need it. The second one is you want to avoid inappropriate prolongation of dying. When it's time to die, let me die. The third one is achieving a sense of control. I think many of us know seniors who know how important this is. But if for people who are dying, they need to know a sense of control. They need to have burdens relieved. Issues of cleaning the house, dealing with problems, finances, what have you. They need some burdens relieved. And they need to strengthen their relationships with their loved ones. This is a time to bring the family around, to heal wounds and talk and everything else. Now, the fifth one, again, there is not a lot of research. Marcus, keep please doing your research on home care. Nina, please keep doing your research on home care and publish it. And every other province across Canada needs to get their hands on their home care data and analyze it and get the word out how scarce it is. The data I'm going to show you right now is I've done 2 home care studies in my province, getting all of the data on home care. And what was interesting, again, is of all of the people who get home care in Alberta, only 4 to 5 to 6%, depending on the year, were designated as palliative. That means a very, very, very small proportion of dying people get any home care in the last year of life. Very, very small. And in fact, in Alberta, only 2% of Albertans get home care each year, 2%. Now, I'm not quite sure how that works, in BC. I suspect it's fairly similar. There's some provinces in Canada where it's less, some where it's more. So 2% of Albertans will get a bit of home care, maybe lots of home care, but they are registered as a home care client. Now, compare that to the fact that 9% of Albertans are admitted every year for at least 1 day in hospital. 2% get home care, 9% get admitted to hospital. Now, we know that hospitals are a lot more expensive than home care, and Marcus has done a nice job about talking about the wellness feature of home care, the hospital substitution, of home care. So again, think about where we're putting our money. Now, what's interesting, if you look in Alberta at the people who are designated as palliative care, so these are the ones who actually get extra home care because you're seen as palliative, having higher needs. So the case manager came in and saw they have higher needs. Typically, you will get home care for 90 days, so the last 3 months of life, and it will be at the rate of 2 hours per day. That is what you will get when you are actively dying in the last 3 months of life in Alberta. Now, if you happen to be one of the older persons who, is disabled needing some home care, those are the people who get 2 hours a week on average. Now, what's also interesting in Alberta, and I suspect this is similar all across Canada, is that 70% of the care hours, or 70% of the actual visits when somebody comes in, are provided by unlicensed care aides. Very low education often, typically immigrants, students, who are working alone but under RN supervision or RN case management or care planning. So 70%, and this has not changed over time. So again, we rely a great deal home care from people basically who have very low skills at assessing people, helping them or whatever. And my conclusion, I believe now that there's a rapid increase in the number of persons, mainly baby boomers, but also their parents, who will need periodic home care because of serious chronic illnesses, life-limiting illnesses, but also a rapid increase in the number of persons who are going to need home care because they are just quite simply dying. Hospices are going to be increasingly needed, and greater supports for all kinds, but particularly family caregivers, because we know families are having to do a great deal, and also these nursing care aides who are dealing with dying people and maybe not prepared for it. And of course the alternative is keep doing what we're doing now, which is having full hospitals and emergency departments. So anyway, I'll be happy to come back to those questions, and I've got some references if you ever would like to have them. So thank you very much.